Hello, and welcome back to another episode of the Mermaid Vet Podcast. I'm your guest host today, Dr. Peter Mosites. Tim's not with us right now because we're coming at you with a special bonus episode. We've got here Dr. William Close. You want to say hi?
Hello.
And we're going to be talking to you actually about an upcoming project we're very excited about called Mermaid SANDS. First, let's introduce Will here. Will, tell us a little bit more about your background.
Yeah, for sure. So my background is I have a PhD in immunology and microbiology, specialty in virology, so studied viruses and how they put themselves together. More importantly, though, Peter and I actually go back about 20 odd years, met back in high school. So about, was that 2021-ish?
Yeah, fall of 2021.
Yeah, Peter approached me about helping out with SANDS and getting it off the ground. And so, I was more than happy to get involved. And so I am currently the vice president. And yeah, it's been quite the journey to get to this point, and very excited about what's about to come.
Yeah, and we will definitely dive into all of that. So you keep hearing us say the phrase Mermaid SANDS, probably worth diving really quickly into what is SANDS, why do we keep saying it, what does it mean, and how does it relate to the larger Mermaid brand? So SANDS is an acronym. It stands for Spay Neuter Dental Services, and it is actually going to be independent nonprofit veterinary practice. What it's going to focus on is going to be providing low-cost spay and neuter services, dental cleanings, preventative medicine, so vaccines and flea, tick, and heartworm preventions.
So going off of that then, Peter, what gave you this idea in the first place? Like, what is it that you're trying to address within the local community?
So the inspiration for SANDS really came from seeing a need inside the community for accessible veterinary services and realizing that our capacity as a full-service veterinary clinic over at Mermaid Vet Hospital didn't necessarily provide the operational efficiencies that we'd need to be able to provide these services at that lower cost. So when you look at veterinary medicine kind of broadly, you can see that there's a lot of pets that aren't getting the care that they need. And we can look at our individual practice and our individual cases and say, oh, I wish this owner could do this, or I wish this owner could do that, which is true. There are a lot of services that just not everyone's able to afford. Tim and I talked about that on the last episode. Mm-hmm. But even beyond that, like you look at the pets that aren't ever even coming into a clinic. There was a study in 2017 that showed that 35% of cat owners said they either never take their cat to a vet, or if they do, it's only in the case of emergencies. There's another study that you can find on the American Heartworm Society website, which we talked about heartworm prevention and the importance of that, and how that was one of those things that when we're taking cost-cutting measures in terms of our veterinary care, try not to touch the heartworm whenever possible because it's so devastating. And the American Heartworm Society has found through their surveys that only about 55% of dogs in the U.S. are on heartworm preventative. When you look at dental care, dental care, mm-hmm. again, being another thing we touched on last episode, showing how important it is to lifelong health and how big of an expense it can be if it's put off. But one survey showed that only about 1 in 8 dogs ever receive a dental cleaning in their lifetime. That's not that they're getting it every year like they should, or every twice a year like they really should would be ideal. That's ever at all. And unfortunately, the estimate for cats is going to be even lower than that. So there are a ton of animals that need care that aren't getting it. And these are basic services. So there's definitely a need for it. And one of the things that we found locally is that even though there's really some amazing programs that are present, that the demand for it is outsized compared to their capacity to provide care. Like there's always more need than what these other wonderful programs are able to provide. So mm-hmm. we saw an opportunity to step in and create something a little different, a little new, bring our unique mermaid approach to the problem.
Yeah, and so just to be clear, the intent for this new clinic is to focus solely on dogs and cats, right?
Yes, we're going to be focusing solely on dogs and cats and solely on that preventive medicine, that especially early life care that really sets pets up for a good lifetime of health.
Got it. So you said it was going to be low cost. Are you going to be doing any free or charity work, anything like that?
Yeah, so we're going to be low cost, but we do plan to be able to run the nonprofit off of revenue from regular operations And we're going to use donations to be able to provide pro bono or free procedures to members of the community.
So then how would you actually go about keeping the cost low? I mean, that's obviously really important being a nonprofit. What sorts of, steps or limits are you planning to take?
That's a great question, because it's one thing to say that you want to do something low cost, and it's another thing to be a full service practice and in private practice and see what the realities of providing care is. It's crazy. We think about veterinary medicine as being sometimes lesser than in some way than human medicine, but when you're purchasing medications, they are basically the same medications that you're getting for humans. And so if you have high cost insulin or high cost EpiPens, stuff like that for people, they don't make special cheaper dog versions necessarily. If anything, they end up being more expensive because you've got to do the chewable version, the flavored version to convince your dog to take it, because you can't necessarily just give them instructions and trust that they'll follow those at home. Same thing applies for blood work. Like, there's no special cheaper dog version of finding out what blood glucose is. We're using this literally the same or equivalent supplies as human medicine, and as those costs go up, so do veterinary medicine. So how do we keep costs low then, if we can't necessarily take away from the inherent costs of medicine, and we don't want to take away essential parts of the care? So our way to keep cost low is to be as operationally efficient as possible. So we're going to have the same doctors using the same medications, doing the same surgical techniques as we would do in a full service practice, but we are going to limit the scope of what we do at Mermaid Sands in order to be as operationally efficient as possible. So what that looks like in practice, we're going to be limiting our services, like I mentioned. So only spays and neuters, only dental cleanings. There's going to be no extractions. There's going to be no dental surgery. This is get that tartar off, set these pets up for a healthy life, get the dental care in, before it's an emergency, before we have to do any kind of heroics, trying to get a lot of teeth extracted, trying to get gum work done to be able to get them back to where they need to be.
Yeah. So I guess in terms of, dental care and stuff like that, I have a Chihuahua and a Wiener dog mix as an example, and she has certainly required extensive dental care. So is this sort of services that can also include like anesthesia and those sorts of things, or is it just as basic as it can be?
No, that's a great question. We do full anesthetic dental cleanings because that's the proper way to do it. So if we're using an ultrasonic scaler the way a human dentist would at a human dentist practice, you can imagine dogs are afraid of vacuums. So just imagine a vacuum in their mouth making that same noise and vibrating their teeth. Most dogs, even the best dogs, aren't going to sit still, keep their tongue back, keep it out of the way, and keep their mouth open for 15, 20 minutes while you're cleaning their teeth. So no, this is full anesthetic dentistry. It's not including extractions. It's not including dental surgery. So this is something that's going to set them up to be able to get the best dental health moving forward for their lifespan without necessarily being a full service dental clinic.
And then I guess if you're not doing extractions, again, because my dog Molly has had a few, how would you recommend patients handle that if you were to get in there and see, oh, this actually needs to come out?
Right. So if we get in there and we see that there is a lot of dental work that needs to be done, we'll make a referral. We'll get the teeth cleaned. We'll get them so at least the bacteria is taken off of there and they're not having hopefully further damage. If there's tartar pushing back the gum line, it's not going to continue on. But if there is significant damage already to those teeth, then we'll make a referral to a full service practice. One of the other reasons why we don't necessarily expect to be seeing that is because we're going to limit the age of our patients. And so, how old's Molly?
That's a good question. Let's see. I want to say she's around. She'll actually be turning 11 in April.
Yeah, so that is a good long life. Dog years, I guess that's what she's pushing her 80s at this point.
Yeah.
So most dogs start to develop dental disease before the age of 3, and most dogs will start to develop dental tartar by 6 months old, or 6 to 18 months old, right? So in there somewhere. And so we want to be able to get in and do that first dental cleaning to make sure that we're getting them a good start. We're pushing all of that back another 1.5 to 3 years. So we're actually going to be limiting our age range for our patients to patients 3 and under. And so that's going to let us get in there, make sure that we're not as likely to have other pre-existing conditions. We talked last episode with Tim about blood work being a way of managing risk, especially prior to anesthesia in animals. And when we go in there with a younger patient, it means that unless there's a congenital or condition that they're born with, they're less likely to have damage to their organs already. They're less likely to have anesthetic complications. So this is our way of, if we're not necessarily doing pre-anesthetic blood work to keep costs down as much as possible, that's our way to mitigate risk in that way. The other way that we're going to be staying operationally efficient is by being drop-off and pick-up only. So our clients are going to be getting their instructions for how to take care of their pets, what to do before surgery, all in the form of a written communication or in videos that we'll be making. And when you come in, you'll drop off your pet, you'll get instructions, you'll get a pickup time, you'll come back, you'll pick them up, you'll get medications, you'll get instructions to go home, you'll get your cone of shame, but you're not going to necessarily get that one-on-one doctor time. So that's really where we start to see the difference between a full service practice and what we're planning on doing here, is that you're not going to get that one-on-one doctor time, those personalized questions answered, all of those different things that you're paying for service-wise with a full service practice. So I guess one of the ways to think about it in terms of, if we're looking at restaurants, it would be getting the to-go version of Outback versus the full sit-down, sitting at the table, getting a waiter, getting customized orders, all of those things. So you're still getting the core of what you're looking for, but you're not necessarily getting all of the service around it. And that will let us keep our doctors doing what they do best, which is doing surgery. And a lot of doctors, we do a really great job talking to people, and that's not going to help us to keep as many animals as possible getting the care that they need.
So then in terms of the 3-year limit, is that something that will be into perpetuity, or is that something that you're open to maybe changing in the future?
I mean, at least initially, we're gonna stay pretty strict to that. Obviously, we don't have birth certificates for animals, so we're not going to be able to chase people down and say, I think your animal's 3.5, so kick them out. But the idea there is that we're looking for pets before they have other pre-existing conditions. So I should also note that I mentioned congenital conditions. We are going to consider short-nosed breeds part of that. So if you've got a pug, if you've got a French bulldog, they're not going to be taken at this facility. And the reason for that is because they have anesthetic complications. They've got such a short nose that they have difficulty maintaining their oxygen supply. So they are more complicated anesthesias.
And then in terms of follow-up, say, for example, a patient does have questions after the dental cleaning, who would they reach out to in that case?
So in that case, we're not looking to replace a full-service veterinary clinic. We'd want to make sure that our clients are getting set up with a full-service practice to continue the basis the foundation we're starting for them lifelong. So we'd refer them back to their routine veterinarian. In terms of surgical practices, we're going to be using absorbable sutures. So if everything's going well at 2 weeks, there wouldn't necessarily be a need for a recheck. You'd just take that cone off. We definitely would recommend following up with your routine vet. That's a great opportunity to get established with someone. But there wouldn't necessarily be any specific follow-up at our facility. Okay.
And just in terms of dogs at that age, what is the recommendation actually for frequency of cleaning? Is it that it just happens once in those first 3 years, or I'm trying to think of how we did it for our dog, and I think she definitely had more regular cleanings later in life, but I don't remember when she was on the younger end.
Yeah. So you go to a human dentist, right?
Yes.
What is the recommendation for cleanings for a human dentist that they give?
That's a good question. I think it's certainly at least once a year. I think I actually go to sometimes even 3 times a year.
Yep. So generally speaking, or at least my understanding of it, human dentists recommend twice yearly cleanings and at least once yearly x-rays. So that would be the recommendation for dog teeth as well. The nice thing for dogs is that they're not drinking and eating the god-awful things that we are that wreak havoc on our teeth. So, God, I hope they're not.
Ours might sometimes.
Those pup cups.
Yeah.
So, yeah, they're not having coffee. They're not having soda. They're not eating Skittles and Nerds, ideally. So they don't have that sugar buildup, that plaque buildup quite as quickly. So they can get away with more. But I would say if you are cleaning your pet's teeth once a year, that's amazing. You're doing an awesome job. If you're, as we discussed earlier, if you're getting your pet in for cleanings basically ever, you're already in the top 1/3 of in terms of pets that even just I see. So any cleaning is great. Would definitely recommend getting at least once a year, twice a year ideally. And what that's going to do is that's going to just extend all those extractions that we're doing because damage has been done slowly to those teeth. And outside of a couple normal processes that happen over the course of a dog's lifetime, those regular routine cleanings are going to lead to fewer extractions. So I actually just cleaned our German Shepherd's teeth, Stormy. We had her in the other day, had a full anesthetic dental cleaning. She gets them done routinely. She is turning 9 this year, and she's yet to have an extraction.
Oh, wow.
Yeah, so she's got wear on her teeth, right? Because she's a German Shepherd. She chews on things she maybe that aren't going to be the best for her teeth at all times. And there's accidents and things like that as she, bashes her face off of random things that she's running past as she's being crazy. But she's not had any extractions to this point in time. And that, even for me, that jumped out to me because she's my first dog, or my 3 dogs are my first 3 dogs as an adult coming out of vet school. And that's why they're getting to the age they're getting to be. But getting to see them reach this point in their life and still have healthy, clean teeth is pretty cool.
Nice. Yeah, that's pretty great. Molly, unfortunately, has definitely had a few, but as I understand it, that's pretty common for the breeds that she's a mix of. Yeah,
very common. And we'll definitely dive deeper on dentistry and kind of the finer points of it, because I'm resisting the urge to dive deep into a tangential topic that is not part of this podcast today. But we'll dive deeper on it. I think that's a great topic we can cover in the future.
Yeah, and I will say if we had been able to avoid some of those extractions, that definitely would have been a little extra money in our pockets, because it definitely adds up over time.
For sure. And then that goes back to our last episode. Okay, so that's what SANDS is. I think it's worthwhile talking a little bit about how we got here, because if you have been around the mermaid universe for the last 4 years, you have heard conversation about SANDS. You've heard the plans, the ambitions that we've had, and here we are in the late fall of 2025, and we just got our certificate of occupancy. So it's worth talking a little bit about the journey of SANDS. Tell me what it's looked like from your point of view.
I am thankful to not have to deal with the real estate side of it. I think that's one of my big takeaways. I mean, it's been, it's that thing where just, let's say, continuing excitement of we're almost there. And at the same time, just one thing after another with, the building, getting stuff set up, getting the county to sign off, all that sort of stuff. And it just, props for sticking with it, because it's been certainly enlightening.
Yeah, so diving into it really quickly, you mentioned I came to you in the fall of 2021 with this idea. We incorporated in early 2022 with the anticipation that I would deploy, we'd start raising money for this venture and as a nonprofit, and then we'd come back, we'd open, we'd be operational. And that definitely was the plan. But to make a long story not too long, basically, the building we were using, we had purchased with the Orchid Island Dog Spa, the kennels. There was an open permit that was incomplete that did not come up on any of the pre-purchase inspections or anything like that. I double-checked the zoning. That was correct. I thought we'd be good to go. A bunch of work had already been done on the building, but it turns out the land use was never corrected. So it was still considered a house for humans to live in, not a business for people to do business in, never mind with animals. So we had to basically go back through, recertify everything that had already been done, do a bunch more work to reinforce the floors and bring them to commercial level, redo the ventilation. We almost at one point had to completely remove and replace a brand new septic tank that had been put in by the previous owner. But we got through all that. We're finally done. We've still got our veterinary and medical and business licensing kind of side of things to get done. But to put it in perspective, we purchased our surgical tables 2 years ago. We paid them off last year on the delayed payment for a startup, and they're still sitting there ready to go. And we just we're excited to get in there.
Yeah, it was pretty fun getting in there earlier this year and helping you clean up a little bit of all the work that had been going on, and just making sure it was ready to go. So I guess with that in mind, when are you actually planning to open the clinic?
So it's been an ongoing joke that we've been perpetually 3 months from opening for 3 years now, because I'd never expected all of these things with permitting, with the building and all that to take as long as it has. So right now we are aiming to open late January. We're going to start as a soft opening. We're going to be giving vouchers to partners within the community, and they will distribute those to pet owners in need. And we'll start off just doing those pro bono surgeries and procedures initially. Because we don't necessarily have the administrative capability to find out who is in need, that's where those partners are going to come in. So we'll be speaking with local shelters, we'll be speaking with other nonprofits in the area to help to identify and distribute these vouchers to individuals in need. Once we have our systems down, we'll start to open up to the general public, hopefully in the spring of 2026. Well, Will, thanks so much for being on today. I was really happy to be able to get you here in the studio to talk a little bit about Mermaid SANDS.
Yeah, it's been great being a part of this process. It's exciting to see it come to fruition, and definitely looking forward to getting the clinic actually open. If other people want to get involved, what would you recommend?
So if anybody wants to get involved with Mermaid SANDS, best way to do it is to go to mermaidsands.org. On there, you can read about our mission. You can make donations. You can also follow us and like us on social media. We're over on Instagram right now. And any donations that are made are going to be going back into helping us expand our services and help to do hopefully more for the community and grow this project to what I hope it can be someday.
Yeah, that sounds great. And again, just very excited to see where this goes. And, January's not that far away. So it sounds like you got a lot of work to do. Or I guess I probably do too.
Yeah, we've still got a long road ahead of us. Well, thank you all for listening today to another episode of the Mermaid Vet Podcast, this special bonus episode. We look forward to speaking with you again here in the near future.